Now we've talked about contracts between the insurance companies and the physician, contracts between the insurance companies and you, the patient. And we've mentioned just a few of the terms in these contracts, and I've said that those terms are there designed to yield maximum profit for these insurance companies. Now let's look at the fruits of their labor. And these fruits are not increased health outcomes for our health system, they are dollars. Let's see how successful they are. Now this is some of the information that I said is disgusting, aggravating. It's disgusting that United Health CEO Stephen J. Hemsley in 2007 drew a salary for himself of $13.2 million, and that he has unexercised stock options of over $744 million to him, and that his home in Wayzata, Minnesota is appraised at almost $7 million. It's disgusting that Cigna CEO Ed Hanway, over the 5-year period ending in 2008, drew a salary of $120 million to him, unexercised stock options of almost $29 million. Here's a note about Cigna, a sad note, mentioning a 17-year-old girl who died only hours after Cigna reversed a decision and said that it would pay for a liver transplant. But too late, and now their family is suing. But it brings up a personal note of mine, me having spent 17 years in training, whether that be college, medical school, internship, residency, fellowship, ongoing continuing medical education, and 11 years of experience after that in order to do what I do. The very idea of someone like him, who specializes in money, has any impact over healthcare, this is infuriating to me. Humana CEO Michael McAllister. This man drew a salary for himself of $10.3 million in 2007. His unexercised stock options, almost $61 million to him. His home is worth $7 million. Aetna CEO Ron Williams, 2007 drew a salary for himself, $23 million. In 2008, he paid himself $24 million to him. Unexercised stock options, $194 million to him. Coventry CEO Alan Weiss in 2004 drew a salary of $13 million. WellPoint CEO Angela Braley in 2007 paid herself a salary of $9 million, and in 2008 almost $10 million. Her home in Indianapolis is worth $2 million. It's disgusting that Hemsley in 2009 is earning so much money in this year alone that his hourly rate equates to $102,000 an hour. Angela Braley from WellPoint is drawing an hourly rate there of almost $5,000. And it's terrifying to think of all the health insurance companies nationwide from coast to coast. There are a lot of them, folks, all of them with their own CEO, drawing massive salaries like this, perks and benefits, and all the other expenses that go along. Money including marketing, advertising, overhead, underwriting, salaries to other individuals in that company, broker commissions, claims processing, investment expenses, all this money going into that kind of administrative expense instead of going into our health care. And we're talking about a lot of money. That's not even considering this. So net income. So in 2007 alone, net income from these 4 top health insurance companies totals $10.6 billion to be paid out then to shareholders instead of going into our health system. And that's just the top 4. Remember all those companies we looked at? Massive amounts of money. Between 2004 and 2007, Anthem's annual profits grew 89%, while its membership increased by only 2.5%. How could that be? Blue Cross had a department dedicated to finding ways to deny coverage to people and cancel policies. It's through corporate shenanigans that they are able to swindle the American population out of healthcare dollars. And we've still not talked about this. Political contributions. So in 2008 alone, political contributions from the insurance industry totaled $28.6 million to our Congress. Top recipient, Senator John McCain. Now look, I don't fault Senator McCain for having taken that money. After all, the insurance industry is cramming it down his pocket along with everybody else in Congress. I have fault with the overall system that would allow this kind of thing, because money going into their pockets like that makes them compromised, makes them biased. How can they do what they need to do when they're receiving money from lobbyists like this? Here's a photo of Senator Baucus. What's in his wallet? They say $183,000 from insurance companies and $229,000 from drug companies. Again, how can he not be compromised, biased by that? He's a very honest man. And I know Senator McCain is a very honest man, but it's human nature. You can't help but be biased. I hate that system. Blue Cross Blue Shield in the past 10 years has spent $101 million lobbying Congress. That's just Blue Cross Blue Shield. In 2007, United Health Group, this is just one of those insurance companies, has spent over $12.6 million lobbying against health care reform In 2007, Aflac has spent almost $1 million in that year lobbying against healthcare reform. They don't want healthcare reform. Those insurance companies are like, they're crying like spoiled brats right now. Congress is getting close to passing some form of reform. They don't want it. They want to protect their way of life. They'll do anything to protect their way. They released some research recently stating that if reform goes through, that premiums in healthcare will go up. Well, sure, they'll try. As long as you constrict their purse strings, they're going to try to increase premiums. It's ridiculous, though. It's just another indication that we need a single-payer, not-for-profit insurance that deals with the bulk of the healthcare and preventive care in our health system. This should be held sacred. We should not allow corporate profiteering to come in and interfere with the bulk of what we do in healthcare and preventive care. This should be considered more or less an individual right and a national moral. Anything else just can't be allowed. It's not to say that private for-profit insurances couldn't still exist. They can, but they need to be secondary, supplemental, something on the side, optional. Something to cover cosmetic issues or some other parameter that's not covered in the bulk of what we do. In some countries, it's used to get a little bit more speedy care for certain issues. But still, if they are allowed to exist, they still need strict regulation and constricting oversight to no longer allow them to commit the atrocities and fraudulent behavior that they have demonstrated increasingly over the past generation. Those for-profit insurance companies are sharks. And let me emphasize the fact, for them to make a profit, they have to deny somebody health care. There's no other way around that. That's inherent within the system. It's built in. There's no way for them to make profit in our system other than by denying people care. And as long as they can make a profit, they will make a profit. And as long as these are large corporations tied to Wall Street with shareholders, they will always be making massive profits. And I don't care what legislative barriers you put before them, like Congress is trying to do now. They're saying, well, okay, well, we won't allow them to do riders, or we won't allow them to do underwriting in the way that they do. They will always find ways to swim around those barriers and find their profit, because that's what they do. It's their nature. You can't get around it. I'd like to close this video with an exercise in visual imagery. I want you to do something for me. I want you to imagine the face of someone that you love. It might be your child, it might be your spouse, might be your parent. You picture them happy, vibrant, full of love for you. But now imagine something's gone wrong. There's been an accident, or they've been diagnosed with some serious illness. I've seen this too frequently in medicine. It can happen in a heartbeat. It can rip your insides out. Everybody in the family feels that sinking pit in their stomach. It's terrorizing. And tell me that there's not anything you wouldn't do for them, but it goes beyond what you can do. You become very dependent on our health system. We all need our health system to be the best it can be. We need it to be the best in the world. There's no reason why it shouldn't be, but it's not. Of the 191 major countries that are assessed, their health systems are assessed, we rank number 37. And yet we spend more than any of them. Why? Because of all these corporate shenanigans that I've been talking about. They're taking all this money. We're talking about massive amounts of money. And how can it not drain our system with that going on? Now look, right now, forget your political party. Forget what you do for a living. I want you to only think about your family. After all, our loved ones are all we have in the beginning and in the end. Now you look me in the eye. Is this really the insurance system that you want for your loved ones? Not only is it immoral, it's dangerous. Corporate profiteering is one thing in the banking and finance industry. We've seen their indiscretions recently in the auto industry or whatever sector you choose here. But it's a very different thing in healthcare. It doesn't belong in healthcare. You don't mess around with people's health. Now, I'm going to make one more video. And in that video I'm going to share information about my clinic like I said I was going to. And I'm going to talk about healthcare reform and how our system could be so much better. And I'll also share how maybe you can help if you care to. It won't cost you anything other than maybe a phone call.